Meet Carol. She runs the emergency department at a busy hospital. She's noticing that the admittance rate is higher than normal. It's not pneumonia or flu, but she doesn't know where to start to find out what the problem is. Meet Dave. He manages an urban clinic in a community where cases of diabetes are increasing. Dave is trying to decide if he needs to employ a diabetic nutritionist to help his patients manage their condition. In order to do that, he needs to know how many diabetic patients he has, how their diabetes has been controlled over the last 2 years, and whether they're coming in for regular checkups. Both Carol and Dave know that the answers they need is somewhere inside the tons of healthcare data their organization collects. But how do they know what questions to ask the data to try to solve the problem? They need a way to automatically turn the clinical free text captured by physicians into searchable information. That way, they can look for commonalities in the newly structured data, like symptoms, diseases, or even missing information. They need CLiX ENRICH. CLiX ENRICH is a suite of tools that will automatically structure clinical free text and returns it as information-rich output that you can search and query in a universal and precise clinical terminology. CLiX Author is the query tool that lets you ask your data questions to narrow down your search and help you find the answer faster. So instead of wondering what the answers to his questions are, Dave uses CLiX ENRICH to structure his data and find the information he needs. When Dave looked for the answers in his data, he could motivate employing a dedicated nutritionist and even improve the clinic's diabetes care management quality score. Carol combined the structured data from the hospital's EHR platform with searchable information returned by CLiX Author to see patient trends that weren't clear before. She now has a starting place to understand and solve her problem. She can look for common symptoms or reasons for attendance patterns, identify a key piece of information that isn't being collected but should be, and even find out if it's possible to prevent reattendance or readmittance. By asking the right questions of her data, Carol can make informed decisions that ultimately impact the cost and quality of care delivered in the ED. And you can too. To discover what information is hidden in your documents, visit Clinithink.com.